joining our weekly meeting with our county health officer dealing with the COVID-19 emergency. And again, welcome to our friends who are joining us on the YouTube channel for Tippecanoe County Government and on the County Health Department's Facebook Live stream. We'll begin, as we often do, by introducing the members of the panel, and then we'll turn things over to Dr. Jeremy Adler. Seated to my immediate right, Dr. Wickert from Franciscan Health, Mayor Tony Rosworski, Mayor of the City of Lafayette. I'm Tracy Brown, Tippecanoe County Commissioner. To my immediate left, Dr. Jeremy Adler, our County Health Officer, Mayor John Dennis, and Dr. Bean from IU Health. Dr. Adler.
Thank you, Commissioner Brown. The format for today's press briefing will be similar to our previous press briefings. I will provide some updates on a few topics related to COVID-19. Then we'll have time for our panelists to make any comments if they wish to, and then, of course, time for questions from the media and also from our Facebook Live. As of today, the U.S. has over 1.3 million confirmed cases of COVID-19 with over 82,000 deaths. Here in Indiana, we have 25,473 confirmed cases of COVID-19 and 1,482 deaths. In Tippecanoe County, as of today, we have 261 confirmed COVID-19 cases, and our deaths are still at 2. It is interesting to note that here locally in Tippecanoe County, the demographics of our COVID-19 patients, the majority of individuals are between the ages of 20 and 50, with the highest incidence in the 20 to 29 age group, accounting for 22.6% of infections, trailed by 30 to 39 at 21.1%, and the 40 to 49-year-old segment at 19.2%. The Tippecanoe County Health Department several weeks ago began collecting data from local healthcare providers about suspected COVID-19 cases. Last week I reported that number to be 5. It still remains 5 that have been reported to us. The State Department of Health is collecting data on clinically diagnosed COVID-19 cases, and they've been tracking deaths due to probable COVID-19. As of today, that number is 139. Here locally, between tests from the Indiana State Department of Health, our hospital labs and commercial labs, well over 5,000 individuals have been tested for COVID-19. Last week I mentioned the opening of a new testing site in Lafayette at the National Guard Armory. This site is open Monday through Friday from 7 a.m. to 7 p.m. It provides testing that is free of charge. It is by appointment only. It is for symptomatic individuals and also close contacts of confirmed COVID-19 patients. Importantly, the State Department of Health has expanded that testing to now include asymptomatic individuals who are at high risk of COVID-19 because they are over the age of 65, have diabetes, obesity, high blood pressure, or another underlying condition, or if they are members of a minority population that's at greater risk. So that's a significant change in testing capability for our community, the inclusion of asymptomatic individuals in those risk groups. As I mentioned last week, the Tippecanoe County Health Department is closely monitoring several data points, especially as our state and community reopen. The first data point is the number of confirmed and suspected COVID-19 cases, and in particular, the trend in the number of new cases. Thus far, our highest new case days here for Tippecanoe County have been April 26th with 16 cases, May 2nd with 35, May 3rd with 28. Those 2 days, those cases were attributed to the Indiana Packers testing. On May 8th, we had 20 new cases, and just yesterday, May 12th, 15 new cases. So, of course, we'll be watching to see if that trend continues from day to day. The second data point that I discussed last week was the percentage of COVID-19 tests that are positive. Here in our county, that figure is 6.4%, down from 6.94% last week. For the state of Indiana, it is 16.5%. Nationally, it is 13.2%. So we are below the state and national figures for that percentage. In terms of number of hospital admissions for COVID-19 and ICU admissions for COVID-19, our local hospitals have seen a little bit of an increase